Hello everyone, my name is Jeannie Jandak and I'm a dental hygienist with Senior Dental Care. I have been a practicing dental hygienist for 29 years and I have been with Senior Dental Care for the past 2.5. On behalf of Senior Dental Care staff and clinicians, I want to let you all know how much we appreciate those of you who remain on the front line during this COVID-19 health crisis. These are certainly challenging times for all of us. We at Senior Dental Care would like to do our part to help you with the care of your residents during this critical time. We want to make sure you have the resources you need to address any oral health emergencies that your residents may experience at this time. I will also tell you how you can access our teams if you do need to speak to a dentist, either via phone or through our new telehealth option. During this webinar, I'm going to talk through some key things to look for when determining if a patient needs emergency dental care. If you have any questions during this presentation, please type them in the chat box below. Dr. Flesher, our dentist, as well as Shelley Anthony, a fellow hygienist, are standing by to help answer these questions. If you're watching this at a later time, you may email questions directly to me at jjandak@myseniordentalcare.com. Let's start by talking through how to assess a dental emergency. Gathering some specific information from the resident will be beneficial for the dentist to make an informed decision on how to best help the resident. If a resident states that they have tooth pain, here are some questions that you can ask the resident to help narrow down the problem. Ask them where the pain is located. Ask them if they can pinpoint an exact tooth where the pain is coming from. Is it on the right side of the mouth or the left side? Is it an upper tooth or a lower tooth? What type of pain are they experiencing? Ask the resident if the pain is sharp, if it's achy, or if it's throbbing. And sometimes if they don't understand the word throbbing, you can tell them it feels like a heartbeat in the tooth. Is the area sensitive to cold or to heat or to both? Does it hurt when they chew their food? Does it hurt when they're at rest? Is the pain keeping them up at night? It's also important to note whether pain medications were given, and if they were given, ask the resident if it helped the pain. Also inform the dentist of the type of pain medication given, how much, and how often. You may encounter a resident that has a dental emergency in the absence of pain as well. So let's go through some of the things you may see visually that may be cause for concern. When doing a visual assessment of the resident, check the outside of the resident's face for swelling. Here's an example of what facial swelling from a dental issue may look like. As you can see in the picture, this person's face is not symmetrical. The left side is rounder than the right. So this indicates that the patient does have some swelling. The lymph nodes in the neck can also swell if there's a dental infection, and oftentimes they swell on the same side as the infection is located. Take a look in the resident's mouth. Do you see any swelling or redness in the area of the pain? Here's a picture of healthy gum tissue versus unhealthy gum tissue. Healthy gum tissue is pink and firm, and unhealthy tissue will be red and puffy. Sometimes you can even see bleeding in the tissue or pus around the area of the tooth where the pain is located. If the resident can pinpoint an exact tooth that's painful, look to see if the tooth is cracked. Here's a few pictures of examples of cracked teeth. I also have another picture here of some swelling around a tooth. So if a patient says that a specific tooth is hurting them, check the gum tissue around the tooth to see if it is puffy or red or swollen. Do you see what looks like a pimple on the gum tissue, either above the tooth, if it's an upper tooth, or below the tooth, if it's a lower tooth? Is the pimple draining pus? Now, when you initially look at the pimple, you may not see anything going on with it, but when you touch the tissue around the pimple, pus may express from the pimple itself. The pimple is called a fistula. So here's a few pictures of fistulas. I have a fistula around the front tooth. I have a couple of fistulas on back teeth. The fistulas can be different sizes. They can be very tiny and they can also be pretty large. And again, you may see pus coming out of them, you may not. But one of the best things to do is either take a gloved finger or even a Q-tip and press lightly next to the pimple and see if you see any pus coming out from it. People can also have a fistula and not have any pain with it. So just keep that in mind as well. The information that I have shared with you today is meant to be a basic guideline for assessing a resident that is having an oral health emergency. If you're unsure whether it's a true dental emergency or if you're unable to fully assess a resident's oral health, please don't hesitate to call us. Knowing that dental health plays a critical role in the overall health of your residents, we want to make dental care easily accessible for you should a dental emergency arise. Senior Dental Care has implemented a telehealth platform to help you handle any dental-related issues that may arise while caring for your residents. To access telehealth, please contact your clinical support manager by calling Senior Dental Care at 877-674-1211. The clinical support manager will then set up a telehealth call with the dentist on call. Should a resident experience a life-threatening dental emergency, please make arrangements for the resident to go to the nearest emergency room. Thank you so much for taking the time to watch this webinar. We at Senior Dental Care appreciate the opportunity to work with you to provide quality care for your residents. Please be on the lookout for a follow-up survey. We would greatly appreciate your feedback. Our next webinar will be Tuesday, April 21st. The topic of that webinar is the importance of good oral health. Thank you so much. Thank you for watching. If there's any questions, if you want to post them up in the question and answer box, we'll answer them for you. I have Dr. Flesher and Shelly Anthony also with me to help answer some questions. We did have a question about whether or not we're going to discuss the care of dentures and partials, and we will be doing that. We have several topics coming up in the next few weeks. Next week is going to be all about the importance of good oral hygiene. And then we'll be talking after that about brushing, flossing, rinses, taking care of dentures and partials, and some other dental topics as the weeks go on. Let's see. How does the fistula form? I'm going to let you handle that one, doctor.
All right. Hello, everyone. Yeah, so a fistula is just infection that usually originates in the tooth, and it's looking for a way out. And usually the path of least resistance for that infection to get out of the tooth and drain is through the bone. And so what happens is eventually it works its way through, and you see that kind of swelling and pressure on the gums, as we kind of showed in the video. And it kind of, before it drains, it swells, and then eventually has an outlet. And usually at that point, the resident will get relief, and often that's the time where people feel better and they think that the problem has gone away, but the actual source of the problem is still the tooth, and we should still take a look at it at that point.
Great. Somebody else asked about fevers, if it's common to run fevers with dental infections.
Yeah, you definitely can. Not always, but that can be a symptom, a sign of something going on in the mouth. So just like we're looking for kind of subjective things like swelling and redness and all that kind of stuff, temperature could definitely be a contributing factor. So kind of be aware of that.
And then another question we have is what to do if a patient says they're in pain, or if you notice that they're in pain, but they won't open their mouth or can't open their mouth to assess or investigate.
Yeah.
I'll let you answer that one.
Sure. Yeah. So obviously you want to kind of observe reactions to what we hope is normal activity, eating, conversation, if they're kind of wincing in pain or refusing medicines, or typical other things like food, they're refusing meals. There might be something else to look at there. And I think you had some good ideas on that too, with varying providers. Sometimes they have better rapport with people. So,
Yes,
different times a day, all that is good stuff to do.
correct. Yep, yep. Sometimes some people are just more comfortable with certain providers, and sometimes I've heard nurses and aides tell me that the time of day can make a difference too. Some people are better in the morning with cooperating than they are in the evening, or afternoon is better. So, and the other question is, what if they complain it hurts on and off? So if the pain isn't constant, or if it doesn't always hurt when they eat, um, I would say to that, no matter what, if they're in pain, we want to, whether it's constant or not, we don't want them in any pain. If we can help them, we'd like to. So if you're unsure about the type of issue going on, don't hesitate to call our 1-800 number. We will put you in contact with the dentist if it needs to be assessed. But please call us with any questions, no matter what. If you're not sure, we want the patients to be comfortable and the residents to be able to eat comfortably at all times. So even if it's on and off, or even if you're not sure if it's a true emergency, you can always call and ask, and we can assess it over the phone. If the patient's complaining of tooth pain, should we cease brushing their teeth? And what you want, of course, if there's pain and discomfort, if the tissue's swollen, it can be very painful to touch. But the key is you want to really make sure it stays as clean as possible. So anything you can do to keep it clean, gentle brushing if it's tolerable. If they cannot tolerate the toothbrush, if you have those oral swabs, a lot of times nurses use those to swab people's mouths out. If you have an oral swab, you can gently cleanse the area with an oral swab, put a little water on it, and just gently remove any debris around it just to keep the area clean. Do you have any suggestions about that, Doctor?
No, I think that's all great. Yeah, just doing what you can, given the limitation of pain, trying to still do what you can to keep the area bacteria and buildup free is always going to be best. I was just reading, there's another question here that was basically about a resident who broke a tooth, no pain. They know it broke, but they don't really know where it is. They saw evidence of a broken tooth extraorally, but it's not, they don't know where it is, and nobody seems to be concerned about it. Should they be doing something about it? So when a tooth breaks, the outer shell of the tooth, if you will, the enamel of the tooth, is kind of the strongest barrier to pain and infection and all that kind of stuff. When it opens up, by breaking the outer part of it off, that inner layer is more susceptible to pain, transmitting heat and cold, and getting a cavity. So even if it's currently not an issue, it runs a higher risk of becoming an issue, in addition to the fact that it might now have a sharp and jagged edge that will eventually tear up the tongue or the cheek or both. So even though there's not a current pressing emergent issue, this would be a good use of maybe our telehealth option, where we could try to take a look to see if it's something we should, try to get ahead of before it becomes a true emergency.
Yes. There's another question here. What are some of the causes of swelling around a tooth? One of the common things that I see as a hygienist is food debris, either trapped between the teeth or stuck under the tissue. So keeping the teeth as clean as possible can help with that. And of course, there can be, the tooth itself, if it's infected, can cause some swelling around the area as well. Do you have anything to add to that, Doctor?
No, usually, yeah, like you said, when there's red swelling, it starts with inflammation, and if it's not relieved and removed, it will turn into something more. So that kind of redness and swelling is the first sign of something going on, and definitely be aware and try to address it early as best as you can.
Okay. Looks like anyone else have any other questions before we end today? I want to thank everybody for joining us. If you have any further questions or think of anything after we're done, please feel free to email me and I will get those answers to you as soon as possible. So thank you so much for joining us.